Thanks, Pedro. And first of all, I'd just like to say how privileged I feel to be here today, back in Vancouver after 19 years, at really what is a historic moment for all of our community. And I feel privileged to have been here all day with a number of heroes from our collective response, from the scientific community, from the community, from academia, and thanks especially to Julio for bringing us all together for this really important meeting. Okay. So I just wanted to show this slide because we have quotes from my former boss and my current boss, which I think both just highlight the urgency that we're all working under, and we've heard a lot about that today. We really need to get things right now to focus the resources where they need to be as fast as possible, and I think this start we have increased impetus for that. And what I just want to do today is to just reflect a little bit on the role of the Global Fund as we work towards achieving 1990. What have we achieved so far as the Global Fund in terms of results? And what are those lessons learned? And how can we move forward and evolve the Global Fund to be even more able to really be part of this collective push towards 1990. So just very, very briefly, I realized recently that I think many of us in Geneva sit in Geneva assuming everybody knows how the Global Fund works, and they don't. We're not a normative agency. There are enough people in Geneva working on guidelines already. We don't need to be doing that. We're a funding mechanism. We are investing the world's money to defeat AIDS as well as tuberculosis and malaria. We work very importantly through partnerships at all levels, partnerships that include the folks around this room, communities most affected, at the country level and at the global level. And very importantly, with a focus on country ownership. Countries and implementers know best what needs to be done, and really also looking at performance-based funding. The money goes where we can really achieve the best results. So again, just very briefly, we raise money. We invest almost $4 billion a year to support programs. Countries make those investment decisions. We do not sit in Geneva and make them. We have an independent technical review panel that evaluates the proposals, and then we're not an implementing organisation. Local folks in countries implement. And lastly, we have local fund agents who actually oversee grant implementation. So, in terms of the total resources that for the HIV response that come from the Global Fund, you can see they're relatively small compared to what comes from domestic resources, but also from other international contributors such as PEPFAR, World Bank, and other bilateral agencies. And this just briefly to show you the cumulative disbursements up to the end of last year, and something weird has happened to this slide. So it looked fine when we checked it, but the HIV is the red on there, and it's around 14.6 billion, I think, if I remember correctly. Last week we had our recent results till mid-2015 came out, and as you can see through Global Fund supported programs in the last year, we've had an increase of around 22% in terms of numbers of people on ART that we're supporting. In terms of PNTCT, an increase of around 20%, and 18% for counselling and testing. The Global Fund constantly evolves, sometimes faster than we can keep up with even in Geneva, but it evolves, and our current strategy, which ends in 2016, really has, based on the lessons learned from the 10 years previously, we focused and continue to focus on 5 strategic objectives: investing more strategically, evolving the funding model, actively supporting grant implementation success, Promoting and protecting human rights. This was very key for us to have a whole strategic objective on this. And then sustaining the gains and mobilizing resources. And I'm not going to talk a lot about, in this presentation about the need to mobilize the resources, but it's absolutely key in terms of everything that we've been talking about today, because all of us, I think, who are working in this milieu have to constantly make some very hard decisions about how to use the limited resources that we have. And even though we can better invest and more strategically invest, there's still a lot of gaps. And this is just, again, a very briefly, an overview of the new funding model and how we work. So just some key lessons learned so far. Supporting structural interventions is critical for successful HIV prevention and treatment. So funding treatment treatment alone is just never going to get us there. Meaningful engagement and leadership of civil society, including people living with HIV in key populations, is an absolute prerequisite for success of our contributions towards achieving 1990. We've heard already about differentiation and prioritization in really investing where the new transmissions occur, where the burden is highest and where access is limited. And fourthly, that we really won't succeed without substantially investing more in community responses as an overall part of systems for health. So just very briefly here, structural interventions. I wanted to say something about this. Because biomedical, as we know and we've heard today, is not enough. This is an old slide, but I wanted to just show it to you because it shows within, I think it was 138 lower and middle income countries, some work that was done to assess the number of infections that would continue with the current legal and policy environment, which was often very difficult in terms of criminalising populations and so on. And then if you had interventions for enhancing that environment and making it more safe for people, how you would see improvements. So these are a number of barriers to accessing services that people experience in countries, and the Global Fund has a package of interventions that we can fund and do encourage countries to actually apply for funding to address. We also have new minimum standards within our grant agreements that address human rights, and a new complaints procedure where people in countries accessing services can make complaints and they will be investigated by our Inspector General. Gender, we have a number of priorities here, which you can see, addressing gender-based violence and harmful gender norms, meeting the different needs of women and girls, including female key populations, and also particularly, I think, as we've already heard today, the need to address the issues related to adolescent girls, and then accelerating investment in prevention of mother-to-child transmission and maternal and newborn child health programs. Leadership and meaningful engagement of people living with the diseases is something that is absolutely critical again. If we're trying to reach and better serve those populations, they must be an integral part of every step along in terms of design of programs, implementation of programs, and so on. And the new funding model has opened up a lot of opportunities for us to really model this and support its practice. I'm very mindful of time, so I'm going to slip through a number of these slides. This slide just shows a number of the entry points for that. And then we have an eligibility assessment for countries where we actually assess the involvement of all stakeholders in the concept note reviews and the country dialogue processes. And if it's not complied with, then the concept notes can actually be sent back to countries. We also have a Community Rights and Gender Special Initiative that really is there to support community engagement, development of key populations in the longer term, but also shorter term. So that this is something that's relatively new, but really supports community engagement. Very, very briefly, I think we know all this, that many new infections focus within key populations. We also know that we really have to improve data quality. We've done a number of pieces of work, and there are a lot of ongoing efforts within the Global Fund to actually ensure that we're generating better data, we're doing that in a safer way, we're getting the data we really need to better target programs to where they need to be. We're also very much focused on meeting the needs of adolescents, not only adolescent girls, but adolescent key populations, adolescents born with HIV, a lot of work going on with partners around that. Investing in community responses, again, absolutely key. We're never going to reach the targets unless we increasingly invest in communities. We've heard a lot about that today. These are some of the areas that where we're actually supporting community engagement. And then in terms of moving forward and for 1990 and its implications for the Global Fund, just to say that I think we're working on a new strategy right now, and we're thinking on and consulting widely with all of our partners to work out how best we can actually, as we move forward, have a global fund that really is best going to be positioned to moving us all collectively forward as part of a much broader response in terms of meeting the targets of 1990. But you can't do that without increased investment, not only in treatment, but also in the critical enablers and in prevention. And then very, very lastly, I would like to say that for me personally, it's actually very moving being back here in Vancouver after all these years, because when I was here last time, I remember listening to a plenary and actually turning around to the colleague next to me and saying, "Did I hear that correctly? Did I understand what they said? Does that mean I don't have to plan for my funeral for next year?" And as someone who had a CD4 count of almost 0, it was a really life-changing moment. I think this is another real paradigm shift for us, and I think it's going to take quite a lot of thinking in terms of and collective action to really translate what we as the elite who sit in these meetings are understanding and what that means, to people in communities at the country level. And that's going to be a real challenge, but it's an exciting challenge, and it's a real human rights. It's great progress that we've made, I think, to get to this point, and very, very exciting, and it's a wonderful time to be back here. So thank you.